Okay, it's recording, but we can just cut off the part that you don't want.
We are ready.
All right. Ashley Jetta Garcia is a Colorado native and double alumni of Regis University with 3 degrees, which are dual bachelors of science in mathematics and business administration with an emphasis in international business, and a master's of science in criminology. She is ABD with a PhD in forensic psychology. Ashley is the CEO and founder of AJG LLC and has experience in the following fields: information technology, legal, security, safety, investigations, and project management since 2005. She's worked in the private sector for Fortune 500 and 100 companies, as well as in the public sector. She started working in insurance and investment industries in 2018. Ashley strives to enhance her understanding of different marketplaces by leveraging her traits as a dependable, well-rounded, organized, business-savvy, complex, problem-solving mathematician. And today, Ashley will be talking to us about the basics of health insurance. So I will hand the mic over to you.
Good morning, everyone. My name is Ashley Jetta Garcia, and like Kayla said, I am the CEO and founder of AJG LLC. And we're just going to be doing a quick dive on health insurance because we have 8 minutes. Because health insurance is what it is, I have to give you guys some disclaimers. First and foremost, AJG LLC and its affiliates are licensed and certified to represent various different plans, including prescription drug plans in various different states. Reach out to me if you have more questions or anything like that. And the affiliate right now is myself. I am also bringing on agents throughout the entire United States because I have a huge project that I'm doing for a nonprofit. So reach out if you have any questions on that as well. So just so everybody knows, the Center of Medicare and Medicaid, Department of Health and Human Services, and any other government agency has not endorsed these slides. This is for educational purposes only. You literally need to reach out to me and I'll explain why in a minute, because I need basic information from you to be able to help you with health insurance. So just so you guys know, there are various different types of health insurance. One of them is Medicare. I am structured with Medicare under some of the carriers that I work with, which are insurance companies. I am structured with an FMO. And then, of course, I also do a lot of direct stuff because I own a brokerage, or I'm the CEO and founder of, I'm the managing member of this brokerage, AJG LLC. So within various states, I am licensed and certified to be able to do health insurance. And then I also have to be appointed with the different carriers to be able to provide their services. And then some of the other various products that I offer are like traveler's insurance. It's very important to understand when traveler's insurance needs to be utilized, especially if you are doing international travel, because some insurance companies do not offer international travel protection. So just knowing that. And then of course there's group insurance as well, which you only need a husband and a wife for within a company to be able to get group insurance through the carriers I use. So let's get started, okay? First and foremost, there are several marketplaces, if you have not known this. There is the on market, some people say it's on exchange, and then off exchange. On exchange, there are 2 different marketplaces depending on the state you're in, okay? So there is the federal marketplace, and then some states like Colorado have a state marketplace. In addition, there is an employer marketplace, which is called the shop. And depending on the state, there may or may not be a shop, okay, for employers. And then there is the off marketplace. Within the off marketplace, the basic and most important thing that you want to know is if you are going to get IRS form 1095 or something similar from the insurance, because it is showing that it is credible coverage. If you don't have credible coverage, then you can get fined by the IRS for not having health insurance. Okay, so when you go off market, just make sure you have that form. And then of course with group plans, there is that leverage of just having a husband and wife within a company, and we can actually give group rates that way. Obviously, the more people within that group, the less the rates are going to be. So let's talk a little bit about the cost of insurance and definitions that are very important for everybody to know. First and foremost, there's something called the premium cost. The premium cost is the amount you pay just to have an insurance policy. That's it. Okay. There's the annual deductible. This is the amount of money that you have to pay out of pocket for covered medical services before the health insurance picks up costs. Okay. We have this new thing. It's not very new, but it's new enough that it became part of the Affordable Care Act, is the maximum out of pocket. And what that is the most amount of money you will pay for covered service in a plan year. And then after you hit that amount, all you pay for the rest of the year is your premiums. Okay. We have your co-payments. This is a set dollar amount for covered services, and co-insurance for which is a percentage instead of the dollar amount that you'll pay for covered services. Covered services depends on the plans, depends on if you're on market, off market, if you're in a group plan. Okay. So I'm not going to go into covered services today because this is a general overview. But something I do want to talk about that is
Sorry, your
extremely
device
important,
lost its connection.
and Alexa wants to just add into, is prescription costs. Okay. It's very, very important if you do take prescription drugs to understand that there's something called a formulary list. Within the formulary list, there are covered prescriptions. Okay. And with each company, the formulary list can and will be different, especially in the coming years, because within the Medicare space, we are taking away the donut hole. If you don't know what that is, reach out to me. I'll explain what that is and we'll go in further depth with that. With the formulary list, you want to make sure your prescriptions are covered under the plan, or at least you have 90 days of prescriptions. There is something called step therapy that you can utilize, but it's not always guaranteed if your prescriptions are not on the list that the insurance company provides. Okay. In general, most prescriptions, there are a tiered formula and it goes 1 through 5. Some of them go to 6. Group plans can go to 1 through 4. But the reality of that with the tiers is that as the tier number goes up, the cost of your prescriptions will be more. Okay. And then, of course, just like all other rates, and health insurance goes up as well. So there's all these extra help that people can utilize within the insurance industry. First and foremost, we have your premium tax credit. You can get this through marketplaces. And if you don't understand what that means, reach out to me. I'll help you. And there's income-based CSRs. This is to help reduce your costs for deductibles, co-insurance, co-payments, and max out of pocket. You usually have to be on a silver plan to access those if you are, and also be on the marketplace with these plans. Okay. There is something called Medicaid. This is for people that have lower income and or families and people with disabilities. And then there's also CHIP for children who need health insurance, but their parents don't financially cannot afford or their income is too high for Medicaid. So this is an alternative for children to at least have access to health insurance. And then there's Medicare, which is for people 65 and older or under 65 with certain disabilities, including end-stage renal disease. And then also there is some also extra requirements like environmental health hazards that could give people Medicare. And you can combine some of these as well. There are people that both have Medicare and Medicaid, things of that nature. Okay. But I want to make sure this is a huge takeaway for everybody. Times to pick your plan so that everybody understands this. On the individual marketplace, there is your open enrollment period. This is between November 1st and December 15th. Some states go out a little bit longer, but that's for your plan to go into effect January 1st. And then there's special enrollment periods that you literally have 60 days. Okay. Just remember that 60 days on the marketplace. Okay. And these are the different qualifying events that can happen. And then you have the Medicare space, which you have your initial enrollment period. It's a 7-month window. It's the month that you turn 65, 3 months before, 3 months after. Okay. You have your annual enrollment period, which is October 15th through December 7th. And then if you are on a Medicare Advantage plan, then you have this open enrollment period, January 1st through March 31st, which you can change your plan once during that time. And then, of course, they have special enrollment periods as well. That's a little bit more lenient than the 60-day with the individual side, but it's 2 months. Okay. And then these are the special enrollment periods that you can do. So most importantly, if you change incomes, if you move, if you receive extra benefits, or if you become diagnosed with certain scenario with certain chronic conditions, we can make changes to your plans. Okay. That's the most important thing. Now, what are next steps? You guys can obviously text BNI APPT to 720-775-7353. You can click the link app.ajgllc.com. And then what I would need from people to review plans is your name, email, phone number, address, county you live in, date of birth, doctors, and prescriptions, because those are all important. And I want to thank everybody for coming out and listening to my TED Talk today. Just kidding. It's not by TED at all. It's actually BNI Rocky Mountain Elite. Questions, quick, fast.
That was great.
I have a question. So what is it with this enrollment thing? Why is it that, any other product you go out and buy, you can buy it whenever you want, but for some reason the insurance companies say, well, you can only buy it right now?
It's a combination, and this is my opinion. This is not facts. It's a combination because there's government and company merging together to do this. That's just what it is. But when you go out in the group plans, you get to create your own enrollment periods.
Okay.
I have a question. As far as you said, the 60 days, when does that start? Is that November, December, or January?
The special enrollment periods for individuals on marketplaces 60 days. It's when the occurrence happens. So if you move, we have the day you move and 60 days out to make changes to your plan.
Okay.
Thank you for letting me clarify that, actually. Any other questions? Beautiful. This is the basics of health insurance with Ashley Jetta Garcia. Thank you for coming out.
Actually, I do have one more.
Oh, just kidding. Paul has one more.
So what's the difference between the 60-day and then there's one that said 2 months?
Medicare versus individual marketplace.
Okay.
So when you're 65 or you become disabled, which we hope never happens, for 24 months, and then you get fallen into Medicare, then you get two-ish months is what they do. But on the marketplace, they're a stickler on 60 days.
Yeah, gotcha. Thank you.
Thanks. We can stop recording now.